Good morning, ladies and gentlemen. Welcome to you all at the OPPI Conclave for a day-long deliberation on access, innovation, and reach of healthcare in general, and pharmaceuticals in particular, by the national and international experts. Our special welcome will go to the chief guest, Sri Dilsher Singh Kalha, Secretary, Department of Pharmaceuticals, for carving out some time from his busy schedule to address us this morning. Welcome to you, sir. Our hearty welcome goes to one of the key architects of healthcare reform initiatives in India, Dr. K. Srinath Reddy, world-renowned cardiologist and the President of Public Health Foundation of India. We are honored to have you with us this morning. Dr. Nata Manabde, representative of WHO, she is on the way and she will join us shortly. I welcome our speakers of the conclave and vibrant media of our country, our President, the dear friend of ours, all members of OPPI, for your kind presence. Our inaugural session and the first business sessions are on access to healthcare. Despite so much of stringent government control, debate, and activism on the affordability of modern medicines in India, on the one hand, and the success of the government to make medicines available in the country at a price which is cheaper than even Pakistan, Bangladesh, and Sri Lanka on the other. But the fact still remains, a large percentage of Indian population does not have access to affordable modern medicines as compared to just 15% in China and 22% in Africa. The moot question therefore arises, despite all stringent price regulatory measures by the government and prolonged public debate over nearly 4 decades to ensure better affordability of medicines, why then access to modern medicines remains so abysmal to a vast majority of population of India, even after 60 years of independence of the country. As we know, access to healthcare comprises not just medicines, but more importantly, doctors, paramedics, diagnostics, health centers, and hospitals. That's healthcare infrastructure. In India, the demand for these services has outstripped supply. However, the key focus of the government has still remained primarily on access to medicines. There is urgent need to have a holistic approach in developing adequate healthcare infrastructure, efficient delivery system for medical supplies, and creation of a talent pool of healthcare professionals and paramedics to ensure access to healthcare for all the citizens of the country. OPPI has undertaken a study on enhancing healthcare access in India. The study aims to identify the key barriers in accessing healthcare today, what needs to be done to eliminate these barriers, and develop a roadmap for improving healthcare access in India. The second business session is on innovation. Healthcare industry in general and the pharmaceutical sector in particular have been experiencing a plethora of innovations, not only to cure and effectively manage ailments to improve the quality of life, but also to help increasing overall disease-free life expectancy of the population with various types of treatment and disease management options. Innovation being one of the key growth drivers for the knowledge economy, creation of innovation-friendly ecosystem in the country calls for a radical change in our mindset. From process innovation to product innovation, from replicating molecules to creating new molecules. A robust ecosystem for innovation is a wheel of progress of any nation, and India is no exception. It is encouraging to hear that the government of India is working towards this direction in a more elaborate manner in its 12th five-year plan. In the business session 2, titled Moving Ahead in the Decade of Innovation, two global experts will enlighten us on making India a global hub for R&D and making India a leader in biotechnology. The third business session before the panel discussion will be on reach of healthcare. While India is making reasonable strides in its economic growth, the country is increasingly facing constraints in providing healthcare benefits to a vast majority of its population. This is mainly because of three reasons. First reason, I feel, because of inadequate healthcare infrastructure and delivery system. Second, lack of proper healthcare financing. Insurance system for all strata of society. Currently around 78% of healthcare expenditure is out of pocket and without any health insurance coverage. And the third, difficulty in managing costs of healthcare even when the country is producing generic drugs for a sizable part of the world market. We find some good initiatives for population below the poverty line, and we will hear that in the first business session with RSBY and other health insurance schemes through micro health insurance units, especially in rural area. It has been reported that currently around 40 such schemes are active in the country. As the disease pattern is undergoing a shift from acute to chronic infectious diseases, the reach of treatment is becoming even more challenging. Welcome to you, madam. Thank you. Currently, health insurance schemes only cover expenses towards hospitalization. However, medical insurance schemes should also cover domiciliary or inpatient treatment cost and perhaps loss of income along with hospitalization cost. We shall know much more about it from the experts during their deliberations. OPPI Conclave will conclude with a stimulating panel discussion on the theme of the conclave, improving access, innovation, and reach of healthcare in India, which will help us charting the way forward. I'm sure you all will enjoy the conclave and find it very useful, but please do not miss the opportunity of interacting with galaxy of speakers to enrich ourselves with their perspectives. Thank you.